I would like to begin first by highlighting that the interest in targeting the DNA repair pathway came in after emerging data in prostate cancer and specifically data from the Stand Up to Cancer team work that highlighted the fact that over 20% of patients, somewhere about 20% of patients or more, who with metastatic castration-resistant prostate cancer have actually significant mutations in the DNA repair pathway or the HRR genes. And so that highlighted the fact that this is a clinically relevant pathway to go after, knowing fully that there is evidence of benefit in other tumors at the time of the study design of the in breast and ovarian cancer, and then subsequently in pancreatic cancer and so on. The specific pathway relevance is the following, is that both normal cells and cancer cells need to repair themselves when there is damage. And so the HRR pathway is involved in the repair process, but when there is alterations or mutations, the cells are not able to repair themselves, they fall back into a different pathway, which is the PARP pathway. And basically the PARP inhibitors tend to inhibit that enzyme so that the cells cannot repair themselves. And so that is essentially, in a simple way, explaining how things work.